This is Becky Schultz with Equipment Today. I'll be speaking with Dr. Dan Carlin with JobSiteCare to learn how his company is delivering managed healthcare directly to construction job sites. We'll also learn about TextBadge, a smartphone-based technology that is helping to keep workers safer during the pandemic and has plenty of opportunity to help keep them safer well beyond. Thank you, Dan, for joining me. Can you start off by telling us a bit about yourself, your background, and how you came to found JobSiteCare?
That's a great question. I had a bit of a circuitous path as a young doctor. I was in the Navy. I spent 2 years on a warship, and then I spent a year overseas as a physician volunteer. This was on the Afghanistan war in the 80s. So my formative years were spent many times out of touch with medical care. Eventually, I got legitimate and went back, did a residency, did emergency medicine, and I went into practice. But I was always interested in how do you take care of people far away? Because I had been that young guy far away wondering, gee, what do I do now? I've got a sick person, injured person. Long story short, in the late 1990s, I joined the staff at New England Medical Center, and I did a huge telemedicine project for Stone & Webster. This is a big multinational construction company. I don't think they're around anymore, but the project was fascinating. We had about 6,000 workers building a power plant in Ghana, West Africa. And it was the opening days of the internet. All kidding aside, we used Africa Online. 28 kilobits per second was our bandwidth.
Oh, wow.
But honestly, it was enough to do voice calls, and it was enough to trade pictures. My guy in Ghana would take a photograph of an X-ray taped inside a window. He'd send that to me. I would look at it and go, I think that's a pneumonia, but I'll go talk to a radiologist. And we would get, yep, that's a pneumonia. So I was starting to connect the dots back at the turn of the century about taking care of people far away. The company at the time was called World Clinic. It's still around. We got a couple thousand patients around the world. There's mostly individuals, though. 2 years ago, a safety officer that I had worked with on a construction project in the Bahamas came to me and said, hey, we're doing some stuff in the United States. We want you to look at this. So I said, of course, what's going on? Well, we've got remote solar sites. We're building solar fields, many times nowhere near medical care. People are getting injured. We really need this telemedicine that you've done for us in the past, but we need it in the United States. Now, this was an interesting thing because I really had no idea of sort of how crazy the management of injured workers is. And as we sort of kind of peeling the onion of this problem, I said, oh my gosh, we can fix a lot of things just by doing one or two things right. The first thing to do right was provide a doctor telemedically to the job site. So we built an app for the safety officers of this company. And when they had an injured worker, they'd open the app, tap a button that said call doctor. 35 seconds later, they'd be talking to me or one of my partners, and we would convert the call to FaceTime. And we would see the worker at the job site for the snake bite, the squished thumb. In one case, a really severe knee injury. And in another case, we actually had a cardiac arrest that we ran a full resuscitation in the parking lot on FaceTime. And I'm not kidding. So
wow.
As we were exploring this, we're exploring this going, holy moly, there's a lot to do here. So the first thing, though, was be the doctor in the opening minutes of the case. Let telemedicine bring you to the job site. The second thing that we saw or learned was if you do that and you sort of establish this patient-physician relationship, then you guide all the subsequent care because you know the whole story. I know what happened to this worker. She dropped a cinder block on her foot. There's swelling. There's a little deformity on the outside of her foot. So I need her x-rayed now. So instead of going to the ER and waiting 10 hours or 6 hours or 4 hours for an x-ray, I would send her to an imaging center, a private x-ray center. I'd get an x-ray back an hour later. She broke her foot. Well, I know what to do with that. I'm an ER doc, so we're going to elevate it, get something for pain, a good rigid splint. And then my staff would call an orthopedist in the area and say, we have a fractured foot we'd like to send to you. How soon can you see this person?
Sure.
And that was revolutionary. I had no idea that what we were doing was so revolutionary because we started compressing time in these cases. It was fun to watch because we would look at a case historically. Our partner in this was wonderful. They showed us all their records and loss runs and all this other stuff. And we were finding that we were cutting down the entire duration of the case by 70% just by make the appointment, call the orthopedist yourself, doctor to doctor, tell them what you got clinically and say, and this is what I think we need. I need you, Mr. Orthopedist, to tell me, does this patient need a pin to bring her fracture back together, or can she just be casted? And if she can be casted, give me her limitations so we maximize her healing, and I will convert that to her work status. And now it's been just crazy successful since we started doing this.
And especially in terms of how much time you can save in treatment and being able to facilitate that. That's really impressive. Can you talk us through exactly what JobSiteCare provides in terms of services? What are those services that are available to a contractor that they can implement on their job sites?
The easiest way to think about it, sort of big picture, is this is like a construction company having its own in-house medical department on call 24/7 and exporting the doctor to the job site wherever it is. So you're talking about 24/7, don't care what happened, don't care where it happened. We're going to drop a doctor in there on an iPad or an iPhone, and we're going to see what's going on right away. So that's sort of step one. Bring the doctor in by video right now and seize control of the case. Get the whole story of what just happened to this person. Document all the findings you see. This person said that they fell in the mud. Yep, there's mud on their clothing. Or this person said that not just their hand, but their foot was injured. Okay, let's look at the foot. So you're putting together a really complete story, and then you're doing a really good physical exam. And this is where it gets really interesting. We're fortunate with one of our construction company clients. They go to great lengths to train their site safety officers. In some cases, these are EMTs, paramedics. This is heavenly to me because this is a skilled set of hands. So I can say, hey, we need to take a look at that knee. So I'm going to do some maneuvers to figure out, did this person tear one of the ligaments inside their knee? So they'll help me do a really good exam. Of course, I'm watching the whole thing. I feel pretty good about my working diagnosis. And of course, the thing in the back of my mind is, what's my next step? So for the construction company, they're generally pretty happy because I'm going to tell them within a couple of minutes what the next step is. Like, for example, my broken foot case, our next step is we actually need an x-ray today. Now, this is where we really put this program into warp speed. Our CTO assembled from Google a database of all the emergency rooms, urgent care centers, imaging centers, labs, physical therapy, all the kind of on-the-ground medical office resources, and we mapped them. So when the safety officer called me on his app, I actually geolocated her. And she shows up as a little blinking blue light, a big map. But on the rest of the map are things like, there's the nearest hospital, there's the imaging center, there's the physical therapy. So I already know where my next move is going to happen. I know who we're going to speak with. I've got their phone number. It's embedded in the interface. It's kind of fun because as we got into the project, we started identifying doctors that were really good. I mean, really good. Like, I'll see this person right away. Great at communicating, great at giving us records. And then, of course, the corollary is, Becky, we found some docs that weren't very good,
right?
Or they didn't want to participate, or they're very territorial, and we would say, hey, look, we're all trying to do the right thing here, but I'm going to direct this patient's care. You're a referral, but you're not the primary physician. I am. So that didn't happen too often, but it was fun because when you start focusing on the good doctors, the workers started noticing.
Sure. I bet they did. Yeah.
Oh, yeah. The management started noticing. The really good physicians, they were very aware that our job was to keep everybody safe, healing as fast as possible, right? But we wanted to get this person back on the job site. We didn't want to unplug them from the workforce. Now, they would have restrictions. And there were folks that We had a guy that just really destroyed the inside of his knee and tore his cruciate ligament, all this other stuff. But we had him back at the job site. And of course, his knee is up on a chair and he's got a big immobilizer and he's got crutches. But he was still psychologically part of his workforce. His buddies would come around and give him a hard time about his knee and all this stuff. But he had a great outcome. He got repaired about 6 days later, a couple of weeks of rehab. But he would leave the job site to go to rehab. And then eventually when, his ligaments were all normal and put back together, he went right back to work. He never got to that point where he said, oh, nobody cares about me. Even the guys at work don't care about me. They were still giving him a hard time all the way till the day he went back to work.
I can totally envision that. And I also can see where that could make a huge difference on the time it takes to recover from an injury, because you're not feeling like you're left out, or you're not having the potential risk of just sitting at home wondering if you'll ever be able to get back on the job.
One of the things we learned was, I'd love to say, oh, we're so smart, we're so great. We're not. Part of this is the system was so bad. Meaning a poor guy would get injured, poor gal would get injured. And then this process of filing the claim, then a claims adjuster reviewing records, trying to figure out who is the main physician for the management of the case. And when you don't do that well, a simple case can lag it can go on for weeks, months. More importantly, psychologically, the worker starts feeling like, hey, you're not taking care of me.
Right.
Nobody's communicating with me what's wrong with my knee or my elbow. And that can go dark pretty fast in terms of attitude. And they start to withdraw. And now, the next thing you know, they're going off under the direction of a lawyer to seek their medical care.
Sure.
Big problem.
Big problem. Exactly. Now, I think we could probably talk specifically about all of the things that JobSiteCare is involved in probably all afternoon. But I know that the company has developed something called TextBadge. And I'd like to get into that and learn a little bit more about what that is and how it works. Can you walk us through what TextBadge is all about?
We have about 12,000 seasonal ski resort workers. And we invented TextBadge for those folks, but it's being adopted, going to be adopted. It's already adopted by construction companies. I can't talk about that side of the business. We're a physician practice. We see ourselves as the town doctor to the ski resort company, the construction company, whatever. We were just doing really good work with injured workers, and that they were our village, right? We were the town doctors to these folks. And then along came COVID last spring.
Right.
We sat down as a group and said, guys, we're not going to be taking care of a lot of injured workers anymore as individuals. We're on the hook for some really large workforces, like population level healthcare, because of COVID. It was affecting thousands and thousands of people. So the challenge was, we need to build a system that can monitor 5,000 workers, 6,000 workers, 12,000 workers. We need to monitor them. We have to give them a tool to identify themselves as being at risk for COVID. So we built them a symptom checker. They have to fill out the symptom checker. And anybody who's reporting positive symptoms, our physician group has to jump on right away and isolate them, and then get the whole story. So with TextBadge, if you're perfectly healthy, honestly, Becky, it's pretty straightforward. Every day you open your cell phone and you send a text to basically TextBadge check. We'll call it. That's the address, say, for your company. So you send that text to it and you get back a questionnaire that says, have you had fever? Do you have a headache? Joint pains? All the classic COVID symptoms, the CDC questionnaire. And then you submit your answers. Now, if all of your answers are no and you're in perfectly good health, what you get back is a QR code that is tied to your identity. And it's also color coded for that day. So maybe on Monday it's pink. So you come to work Monday, you've had no symptoms. We've sent you your TextBadge, and you come to your job site. Your boss can scan your TextBadge with any phone and verify it's you and you have no symptoms today. So by all means, enter the workplace.
Okay.
Now, if you don't have a TextBadge, you cannot enter the workplace. So Everybody's got to participate. So the whole workforce has to participate. So if you didn't get your TextBadge, it's because you have some kind of symptoms. Say you just had, a fever and a headache. And we said, well, okay, look, I don't know if this is COVID or not. It might be. So I'm putting you in isolation for 3 days. Now, it turns out about 80% of the time, those folks are better the very next day. And no symptoms, we check on them and we give them a TextBadge and they go right back to work. About 20% of them, though, actually, they start to look like they have COVID and they have to be clinically managed. This is really important. A doctor's got to step in and go, all right, I think you've got COVID. Here's how we're going to monitor your case. And here's when we're going to go get tested. And here's when we're going to go to the hospital. So this program has been insanely successful. Like I said, we've got about 12,000 people under management. We've had 700 people, actually at this point, it's probably closer to 800, who have screened in for a symptom. And we've had about 200 turn out to be true COVID cases.
Really? Okay.
Yeah. So 200 out of 10,000, that sort of approximates the national numbers. Our number, you're kind of right in that 2% sweet spot. More importantly, though, you identified them so early. They didn't go on to be neglected or develop a terrible complication.
Sure.
So you put them on vitamin D, you put them on zinc. In some cases, we put them on azithromycin, or at least get them plugged into their home doctor to get taken care of. Bottom line, 10,000, 700 people who looked like it, 200 people that had COVID. We had one hospitalization and no deaths.
That is really impressive with that number of people that you're monitoring. That speaks volumes about the success of TextBadge, certainly. Yeah. I think that it's interesting that so many different types of contact tracing programs have come out of the COVID-19 pandemic. And it sounds like this is kind of unique, not only in its success rate, but also in how it's being administered. Is there anything else that kind of sets it apart from some of the other things that, other programs that have come out for a similar purpose? Yeah.
So there's a bunch of sort of QR code screening tools. I think the real differentiator here is that it's tied to a physician practice group. In other words, you're using the tool to identify your patients at risk, and then you're jumping in on the physician side saying, hey, let's treat this person like a patient now. They're at risk. That's probably the biggest differentiator, is partnering up and having a clinical practice group to go with the technology. I would honestly tell you the other secret here is this system is insanely easy to use. I mean, the enrollment process is, scan a QR code, put your name in, it already knows your phone number, sure. Right? And then once that's in, then we cross-match against the construction company's manifest of employees, which matches them into their claims management system. So all of a sudden, just by getting that 3-second enrollment, you have a full file established on them. And for the worker, it was reasonably painless. It's very familiar technology. You get your text, you fill out your questionnaire, you submit it, boom, you're done. You get your QR code back and you go back to work.
Is a similar process used for anyone who has to visit the site then as well?
That's a really good question. I'm thinking particularly in the ski resort industry. So these folks are working all day long, snow grooming, ski lift operating, and they have a ton of guests.
Right.
The guests are coming and going, and they're very much being managed or dealt with around CDC guidelines. In some cases, the local county health department guidelines, they've posted posters to guests at the hotels or at the ski lifts. So we haven't gotten to that point where we're bringing TextBadge for the guests. But I'll tell you, if this is with us by next summer, we will. It will be not just the workforce. It'll be the people at the venue. We just looked at a really interesting project around performance music, concerts and such. Sure. The production company, they want everybody on TextBadge. This is an insane industry. They set up, they do a whole show, and 3:00 in the morning, it's like they were never there. 17 semis have left and a production company of 400 people have left. We have a fun project going around that. But they've already said, can you do this for the folks who come to the show next year? If we are still doing this next summer, how can our fans get a TextBadge to see the show? It suggests what might be coming next around vaccination and how are we going to manage crowds? But the very fact you're in a crowd sets you up for risk. So how are we going to leverage these tools to minimize that risk?
And I was going to say, I'm hopeful that we will not be having this discussion again next summer, because I'm hopeful that things will have changed by then, which I think all of us are in that boat. And speaking of which, looking beyond COVID, a technology like TextBadge is offering enormous benefits during the pandemic, but the pandemic will not be around forever, and you have this technology in place. What other benefits can you gain from it? How else could it be applied on the construction site that can help make it worthwhile to continue to utilize it?
Do you remember the space program, all the things that came out of the space program?
Yep.
Here was this huge national challenge, and that had all these benefits that came out of it. This massive global pandemic of COVID-19 virus is actually going to have several silver linings. I think this is going to be one of them, that we're figuring out how to protect a population. TextBadge basically says, I'm allowed to work today because I'm not sick. Okay. In the future, what I think it is, well, I'm already seeing it, is they're integrating TextBadge with safety training. You're not allowed on this job site till you punch your ticket on your training and your training has been signed off on. So you've been compliant with your safety training, and now you can come to this particular job site. So that's sort of the very first thing, is I'm seeing it plugged into education requirements. I also see some really interesting stuff going on in safety technology in construction. I would say somewhere between 100 and 150 really cool devices that are built around safety on the construction site. I think those are devices that say attached to the individual. For example, a little position beacon that goes on your helmet. I can write a rule that your position beacon on your helmet should never be closer than 6 feet to another position beacon. That's for COVID. But the construction company may come back and say, hey, we're going to use that position beacon to do signing in and signing out of the job site, locating workers to make sure that they're in the right spot and never in the wrong spot in terms of safety. So I see a whole bunch of things kind of following onto this that'll have to do with safety and integrating these other safety practices with TextBadge, because all it really says is, I got the memo, I'm with the program, I did my stuff, I'm not sick, and I belong here.
Well, it sounds like there's some fascinating things that it can be applied for. One thing that was pointed out to me is workplace concerns ranging from harassment through improper training protocols. Can you talk through some of that?
There's a huge emphasis on safety. There's also a huge emphasis on dignity. And with a tool like TextBadge, you're coming into work. You're healthy. You're ready to, you've been cleared and you're coming to work. But what about if you're leaving work and on your way out, your badge is scanned or you receive a questionnaire? And the questionnaire is very simple. Did you experiencing anything unsafe at the job site today? And where was it? And again, a team will jump in and get the detail. So for the worker, it's easy. Yeah, we were laying rebar and one of the persons didn't have his harness on. Okay, that's an early warning system. We have something unsafe going on. On the other hand, it could also be along the lines of, were you harassed? Someone give you a hard time? Someone act inappropriately to you? And again, this is your way, you're reporting this as you're leaving work going, yeah, that was a really awkward and really uncomfortable moment I had with my coworker. And now it's flagged, and now there's going to be action. Something's going to happen. So it protects the work site. Say if you had a really aggressive, inappropriate worker, everyone is going to suffer the consequences of that person's behavior unless someone reports it. Barrier to reporting is pretty high. You have to go up, find your boss, and you feel really alone. I'm the only person complaining about this radically inappropriate person. Whereas with TextBadge, it's like, yeah, I do this every day. Yeah, anybody weird? Anything wrong? Was I harassed? Yes. And you know you're going to get a phone call, but you didn't have to, push it over the top. You dropped a notification that this job site might have a problem. And now you're intervening so early before it turns into something really aggressive and dangerous, or it turns into now there's a claim for negligence, et cetera. In the end, honestly, Becky, it means I got a safe workplace where my dignity and my physical safety are protected.
And I could also see potential applications, risks related to drug abuse, but also mental health issues. Mental health issues are very prevalent in the construction industry. And I could see, assumingly, that a questionnaire could be put in place asking about those types of risks on the job site as well. A lot of applications potentially that could be developed with this type of a system.
There's a lot of applications. And to your point, again, the barrier is so low to just activating a system to support you. That's the beauty of it. You don't have to go to great lengths. If you're having a hard time with substance abuse, and there's a lot of substance abuse out there, you don't have to make a big deal about it. You can literally check a box. That's outsourced to people like me and my team. Say, hey, we're going to have a little physician to patient conversation. This isn't going to involve anything but patient physician, not your employer. We're inside the HIPAA cone of privacy. That has so changed the dynamic for the worker. Now they're in a much safer place so much faster. So I think this is going to be a big deal. I think the industry is going to kind of prioritize its needs. And then it's going to say, hey, wait a minute, can we use that TextBadge thing to make that thing work?
Right.
If it's the right idea, we can.
Sure. So it does sound like there is the ability to kind of customize this to individual applications.
Yeah, very much so. Very much so. You can customize the applications. It's fairly easy to integrate with other safety systems, HR systems, time clock systems, all of these things. It's as long as there's a conventional API, application process interface, it's actually pretty easy to do.
I have to say, this has been really fascinating, and I've enjoyed having a chance to learn about all the things that you're involved in. But just to kind of close us out, can you talk about what you see coming down the road going forward for both TextBadge and for JobSiteCare in terms of what you think that you will be able to offer to the construction industry and what types of advancements you hope to see going forward with this technology?
I think TextBadge, just on an everyday, every single worker in the workforce, it's really going to change things in a positive direction. It's going to make it easier to identify problems before they have a chance to unravel into a huge problem. I think it's going to be able to help with safety practices, monitoring practices. I'm absolutely certain of that. So TextBadge, very bright future. For JobSiteCare, it seems almost unlimited right now. We're fixing a really big problem set around the management of injured workers just by doing good medicine and using a little connectivity. Yep. But the core of this thing is it's nothing secret. Just practice good medicine, take care of your patient, organize stuff for them. But it's a massive industry-wide problem where we are today with poorly managed injured workers. I see for us just a lot of growth. I'm really enjoying it. My first construction site was in 1998, and it's a culture I know well, and I love the ethos of it. Let's get this done. Come on, let's get. I truly do. It's a lot like the Navy. There's a willingness to look at new ideas, especially around safety. So, yeah, I think our future is very bright.
Well, I have to thank you, Dan, because this has been really an enlightening and very informative conversation. Thank you for joining me.
Sure, my pleasure.